The mission of Ellis is to take care of the healthcare needs of our community. If you really think about keeping people well, it has as much to do with food, clothing, shelter, education, jobs, as it does with clinical care.
The work of City Mission is to help really the poorest people in our community, people who are homeless, people who don't have enough to eat, people who don't have clothes for winter, children who don't eat on the weekends when the school is closed. So we're helping the most severely impoverished people in our community.
The City Mission is got an interesting partnership with, because I read about their work and very much admired the work of their leader.
We came and asked for a meeting with the CEO, with Jim Connolly.
We need to reach out to organizations in the community who had those core competencies and say, all right, together we need to work to sustain the wellness in the community.
Much to our surprise, Jim not only invited us in, but spent a couple hours with us. And we are overwhelmed by him making so much time available for a place like City Mission and other agencies that were working in the real inner city communities. And he created a community meeting group where he gave us a seat at the table, he gave us a voice, and what he really did, which was brilliant leadership, is he gave us all a stake in creating affordable, quality health care in this community. So it was Jim's availability, his willingness to listen and build a team that really opened up the partnership between us.
Ellis Medicine has been a supporter of this clinic since the original start. They supply for us free lab and free x-ray imaging, medical imaging for our patients. And without that, the patients wouldn't be able to get lab tests and imaging.
Ellis Medicine is doing a lot for a place like City Mission. First and foremost is the Ellis Health Center. That is just an incredible first-rate medical facility that is helping the poorest people in our community. The people we serve know that when they go to that health center, they're going to be treated with dignity, with respect, and receive really first-rate medical care.
The whole idea of a navigator is to really guide the patient and help coach them and help teach them about what's available and how to access health care and how to, in effect, keep themselves healthy. The navigators are the people who say, I've got a patient who's being discharged from the hospital and they need to get to their primary care physician and they need to get to their home and they need to have food and they need to have a hospital bed and oxygen, and their job is to make sure the patient gets from the hospital to the home, help get the patients where they need to get and get the kind of care they need.
Doctors from the Ellis Family Health Center come down to City Mission every Tuesday night and run a medical clinic at our soup kitchen. So talking about taking health care to the front lines, we're providing a meal for people, and in that same dining center, doctors and nurses are coming down and helping people with their most urgent medical needs as well.
If you are well-to-do and well-educated, figuring your way through the healthcare maze these days is very difficult. But if you are in poverty, if you are uneducated, I think it's impossible.
Collaborative partnerships are not only important today, they are essential. The fact is, if you look at the sectors of our community, healthcare, business, education, social work, these sectors can no longer get the job done by themselves.
Without the partnerships in the community, it is impossible for an institution, any institution, to do this well. But if you've got those partnerships, many institutions can do what we've done.